Hey, I'm Dr. Martha Gore, board-eligible OBGYN and the physician behind the Traveling OBGYN podcast. If you're interested in learning more about the female anatomy, especially as it relates to down there, then stay tuned. Hey, I'm Dr. Martha Gore, and I'm the physician behind the Traveling OBGYN podcast, available here on YouTube or any streaming service that you use to listen to your podcast. And today we have our first episode. What we're going to talk about is what exactly is going on down there, okay? Now, we have to talk about those things. I think that you listened to my pilot, the first episode that I had out, the first introductory episode I had out. And I talked a little bit about how we were going to talk about so many different things: sex and pregnancy, sexually transmitted infections, contraception, the list goes on. But in order for us to have a discussion about those topics, we have to start with the basics. We have to know where everything is and what aligns with what. And the best place to start would be talking about what happens down there. What I found is that in my practice, a lot of women unfortunately do not know how to describe or talk about the structures that they have down there. So let's talk about that today, okay? A couple of housekeeping things before we get started. Number one, the most important thing. This podcast, this show is inclusive of all people. If you're male, if you're female, and you want to learn more about women's health, this is for you. If you identify as cis, trans, non-binary, these conversations are for you. Number two, during this show in particular, on the YouTube channel, just because you can visually see everything, I will be displaying some graphic images, and not terribly graphic, but medical images that explore and explain the external and the internal female genitalia. So if you're very sensitive to medical textbook images, then I would just encourage you just to, stop watching the podcast now, go watch one of our other episodes, or tune in for our next episode. But by the way, before you go, just, give us a thumbs up and to subscribe. You know how it is. Make sure you do that. Okay. All right. Thanks. Just kidding. But no, definitely give us some support before you go if you're gonna go, okay? That's the truth. All right. And then number three, I'll provide a list of our references in the description bar right underneath our video, just so then you can go and get that information yourself. So it'll be the references of where the images came from, because they are not mine. Oh no, they are not mine. And then also the information that I got, a lot of the information that I'm providing for you today. It's not going to be super scientific. I wanted to make sure that the language that I chose to speak, was dumbed down, but was just more understandable in a way that's just comprehensive, in a relatable way. So everybody can understand it. That's basically what I wanted to do. Okay. All right, good. You understand. All right. So without further ado, let's get started, guys. All right, guys, we are going to dive right on in, okay? Yep, that first shot. I'm really sorry. We're starting off with the female external genitalia, okay? Now, I got to give my disclaimer one more time. The images that I'm going to show may be a little bit graphic, and this is not to be prude in any way, shape, or form. This is just for educational purposes. We have to actually look at these areas to know what exactly is going on down there and also inside of our body, okay? So we're going to go ahead and get started. Before we start going into the nitty-gritty details about the external genitalia, I want to make sure that everybody is aware that this region right here is not called the vagina, okay? This right here is the vagina. This area right here is called the vulva, okay? Now, the vulva is very sensitive and can be very sensitive to different types of scents, creams, lotions, fragrances in that area. And so you really want to be careful when applying different types of creams or strong fragrances in that area. We'll actually have an episode specifically on vulvar health coming up soon, which I know is can be really tricky with a lot of people, okay? So we'll plan that for the future. Now, let's go into the nitty-gritty of the external genitalia. We have to start off with first the mons pubis. It's a bony structure that is right above the separation of the vulva. I want you to remember this structure when we get to the next couple of diagrams. We then have what's called the clitoral hood. This is basically like a layer of skin that's right above the clitoris. You can think of it as a layer of skin that helps protect the clitoris. We then have the clitoris, which is a source of pleasure during sex. Underneath the clitoris, we have the urethral orifice, or the urethra. This is where your urine comes out when you have to pee. Underneath the urethra, we have the vagina. This is basically what you use during penetrative sexual intercourse. This is where your blood comes out of whenever you have your period, where babies come, where you deliver your baby out of. This is the vagina, okay? Now, I need to make sure that everybody is aware. Urine does not come from here, okay? I've had some patients in my past say they are peeing from their vagina, and they honestly literally thought that their bladder was connected to their vagina, and that's just not the case, okay? Please no. Your urine comes from your urethra. Blood, when you have your period, comes from your vagina. However, now, if you are actually having urine that's coming from your vagina and that's what you're noticing, I need for you to go and talk to your OBGYN. Girl, that's not normal, okay? Peace and love, peace and love. But I gotta let you know, I need for you to go see, your OBGYN just so they can do the proper workup and get you to the right specialist, or even, decide to take care of it from their standpoint, okay? All right. Underneath the vagina, we then have the anus. This is where you have your bowel movements, and that's basically the structures if you were to go from up to down. Now, on the side areas, let's talk more about the vulva. We have, like on this area here, more externally, we have the labia majora, okay? And then we have the labia minora, all right? So all these structures here, this all covers the external female genitalia, okay? We're gonna move forward into the internal female genitalia in just a moment. All right, let's move to the internal female genitalia. We're gonna discuss the organs on the inside of our bodies. Now, there are two views that I'm going to use in order for us to discuss these organs. And the first view is if you were going to cut somebody in half and look at them from the side. The second view is if you were going to do the same thing, cut them in half, but look at them from the front. So this is a side view that we're going to start off with. Here, remember we talked about the mons pubis. It was that bony structure that's right above the separation of the vulva. Behind the mons pubis, you'll find the bladder. This is typically where urine is stored just throughout the day, whenever you eat, drink, all that kind of stuff. It connects to your urethra, and this is where you pee. Behind the bladder, you'll find the uterus. Beautiful uterus. This is where the baby resides if you were to be pregnant. It's also where blood were to come from whenever you're on your period. On the bottom portion of your uterus is your cervix. That is right here. And then that connects to your vagina. Really, really cool how that kind of all works together. Now, if you were to have a pap smear or you are due for a pap smear, remember, you do not start getting your pap smears until the age of 21. What OBGYNs are actually doing is taking a soft brush. We're looking into the vagina, going straight to the what's called the external aspect of the cervix, and we're taking that soft brush and just collecting the superficial or the cells that are right on the surface of your cervix, and then sending them to our labs. What we're trying to do is make sure that there are no abnormally growing cells in that area that would be concerning for cancer. So that's what a pap smear is, okay? Behind the uterus, you'd find the colon or your bowels. It then connects to your rectum here, which then connects to your anus, and then that's where you have a bowel movement. Now, this is a view if you were to cut somebody in half and look at them from the front, only focusing on the female structures alone, okay? So here we have another view of the uterus. This is where a baby would reside if you were to be pregnant, and also where blood would come from if you were to be on your period. Here, this is a cervix. This whole structure right here is your cervix. It's kind of like a canal. You can think about it in that sort of way. And this opening right here is called the os. There's two aspects to the os, the external and the internal. Whenever you're pregnant, and if an OBGYN, a nurse, a midwife, any women's health professional has to check your cervix, they're literally feeling the diameter of the cervical os. And there's different things that we use in order to kind of like know whether you're, 1 centimeter dilated, 5 centimeters dilated, 10 centimeters are completely dilated, etc. This thickness kind of changes whenever you're getting ready to deliver your baby as well. Now, if you were to go to the top of the uterus, right, we have the fallopian tubes. You can kind of think of them as kind of like the highway system of the reproductive tract. And then we also have the ovaries on both sides. All right, guys, and that concludes a review of the structures on the inside and the outside as it relates to the female genitalia. Hey guys, and that concludes the first episode of the Traveling OBGYN podcast. Here available on YouTube or any streaming service that you use in order to listen to your podcasts. What did you think of it? If you liked it, please give us a thumbs up. Press that subscribe button. Leave us some nice comments. Nice, emphasis on nice. Guys, I know how you can get crazy. Just chill out. Just be nice to me, okay? Just be nice to me. All right, that's great. So I would love to hear your comments, kind of see what feedback you guys have so we can make this kind of the best experience for not only myself, but for you guys as well. Other housekeeping things. You can expect that our episodes are going to be out every 2 weeks. And then I also invite for you to follow us on our other platforms, TikTok and Instagram at the Traveling OBGYN, okay? Until next time, guys, stay classy, stay fun. See you then.